Okay, it's 2 minutes past 11. Rebecca, over to you.
Thank you, Sam. Good morning, everyone. A very warm welcome to you to National Voices webinar on whether COVID-19 is widening the digital divide. I am Rebecca Steinfeld. I am the head of policy at National Voices, and I'll be facilitating today's webinar together with my colleague Sarah Brooke, who leads on lots of National Voices digital work. Before I say anything more about today's webinar, about its background, the format, who's going to be joining us in this virtual room, I want to hand over to my colleague Sam Beatty, who's going to talk you through how to use this Microsoft Teams platform that we're on today. And the reason for that is that we really want to make sure that your experiences are as engaging as possible. You feel confident using this platform, especially important given the topic of today's webinar. So over to you, Sam. Thank you.
Thanks, Rebecca. I'll just move the slides on. Hi, everyone. I'm Sam. I'm the comms officer at National Voices. I'll be doing the tech today on the webinar. If you've got any technical problems today, please privately message me on the webinar or drop me a line. I've shared my email in the chat. Just to say, we'll be recording this webinar today and it will be available later on our YouTube channel. So there's a couple of points for you to know if you haven't used Teams before. There are 8 buttons at the bottom of your screen if you drag your mouse down. There's a button to control your video, your microphone. What we want you to do right now, if that'd be great, is to launch the chat, which is the speech icon. It's the 6th icon along, as indicated by the arrow there. And just please introduce yourself. And this is where most of the contributions and insights will be happening today. So please put any questions or insights that you have on there, and we'll try and get round to you. Microsoft Teams has a live captions. If you need this, it is in the more options, which is the 3 dots icon. You hit that and then you then click on turn on live captions, and there'll be a preview in the bottom left hand side of the screen. As I said, if you're experiencing any technical problems, please privately message me on Teams, or you can drop me a line at sambeatty at nationalvoices.org.uk. I will give this back to you, Rebecca.
Thank you very much for that, Sam. And just to say, please keep sharing your insights and questions on the chat, and we're going to try to allow as many people to speak as possible. So by way of background, today's webinar is part of a series that we at National Voices have organised that look at the impact of coronavirus and the response to the crisis through the lens specifically of health inequalities. And that really stems from the recognition that though we're all in the same storm, we're not all in the same boat. And we really wanted to provide a forum to explore these inequalities dimensions of the crisis. So far, and some of you may have joined us for these already, we've looked at the disproportionate impact of COVID on BAME people and communities. And we plan to look at both mental health and sex and gender in future webinars. Now, in our last webinar, we looked at how lifting lockdown raises particular concerns for those with disabilities and long-term conditions who were shielding. And we were joined for that webinar by Emily Howe from NHS England and Kate Foster from the Department of Health and Social Care. And they listened very attentively and they responded to what they heard. Sorry, Sam, could you possibly just put everyone on mute, because I can hear quite a lot of background noise. Thank you so much. And what we're really pleased to tell you today is the impact of what they heard. So we wrote to Kate Foster, who's the Deputy Director of the COVID-19 Shielding Policy at DHSC, the Department of Health and Social Care, who was with us last time, to ask how the conversation then really influenced what her and her team had done in the last couple of weeks. And as you can see from this slide, what she told us was that she discussed the issues that had come up with her team, with seniors on both the clinical and policy side, and with relevant departments across government. When I asked if the discussion influenced the work she'd done, she said yes, in terms of how we approach writing guidance and other patient and clinician-facing communications. And when I asked if there were any specific actions she'd taken as a result of what she'd heard or learned, She said, yes, again, they continued a series of meetings with patient groups seeking input and sharing information to the extent possible. They'd conducted specific focus group sessions with groups of young people who were shielding and patient groups that represent older populations. The conversation had shaped communications products in a way that should help them feel more personal and relevant to the individual reading them, expanded on the evidence behind decisions, more engagement with Royal Colleges and patient groups, increased emphasis on clarifying the position in relation to work and the workplace, and working through how they communicate better and provide clearer advice to the clinically vulnerable. And the reason I'm telling you this now is because what it shows is that what we're doing here today is not just a talking shop. We are here to create a space for all of you to have your voices heard and to make a positive difference. So today we're focusing on whether COVID is widening the digital divide. As many of you will be fully aware, COVID has triggered sudden technological changes and innovation in many aspects of our lives, in how we work, meet up with friends and family, and access and use healthcare. For example, in relation to primary care, many people will have experienced GP appointments that have now shifted from face-to-face to being phone or video calls. In relation to COVID, alongside human contact tracers, there are ongoing efforts to develop digital track and trace apps for people to use, as we heard about yesterday from the Secretary of State for Health, Matt Hancock. And as core NHS services restart, the health agencies right now are deciding what are beneficial changes and what is not working, or worse, who's being missed out or failed by these new digital services altogether. And that's why we today wanted to bring you here, those of you who have lived experience of using digital healthcare services and also of health inequalities, charities that are supporting you, and also crucially, people with decision-making responsibilities in this area, so we can all talk together. We have colleagues from NHS X in the room, and that includes Sonia Patel, who's the Chief Information Officer for NHS X, and Emma Halliday, who works on inclusion during COVID-19. And they are here to listen and to respond at the end to what they've heard. And we thank them very much for taking time out of their busy days to join us. We've also already been in touch with Matthew Gould, who heads up NHS X, about our concerns, and we plan to feedback again after today's discussion. So please say what's on your mind, share your thoughts and feelings and concerns in the chat, and hopefully also orally. In terms of the agenda for today, in a moment, I'm going to hand over to Harry Evans, who is a senior programme lead at NHS England and also a trustee for National Voices, who's going to give us some definitions about what is a digital divide, digital exclusion, what we're talking about in relation to all these issues, just to provide some framing and context. Then my colleague Sarah Brooke is going to facilitate a discussion around the 3 questions that you all should have received yesterday. And those are: what digital developments do we think are positive and want to keep? Where are the gaps and barriers that need attention? And what actions can we each take to address digital exclusion and make sure everyone can benefit from digital healthcare? And then we'll have a session at the end where we'll have a response from the people from NHS X who I mentioned who are on the call today. And then I can wrap up and tell you a bit about how you might be able to contribute your further thoughts through the Our COVID Voices platform that we've set up, and also what our future webinars are about. So without further ado, I'm going to hand over now to Harry Evans from NHS England to offer us some definitions. Thank you, Harry.
Thank you, Rebecca, and thank you so much for having me on this webinar. It's a real pleasure, both as a trustee, but also someone working close to these issues in NHS England and Improvement. I work in the population health management team, where we support particularly PCNs to think through how they can be a part of tackling health inequalities. And of course, during COVID, digital exclusion is a key part of that, and a key part of how we support primary care networks. And I'll talk a bit more about that in a moment. I've also over the last couple of years in particular, been involved in a fair bit of research around digital exclusion, and I'll touch on one of those studies in a moment. So thank you. Cool. So just some definitions, and I really want to keep this brief because I want to get on to the discussion and hear what everyone has to say about this, and to move into listening mode, I suppose. So the first thing is, so we've got digital impact on health inequalities, digital exclusion, digital divide. A lot of the time, these 3 things are talked about interchangeably. And the point that I want to make is that it's worth extracting the different themes in terms of these so that we can get a real understanding of what the issues are. So on the one hand, we've got the digital impact on health inequalities. So health inequalities, of course, are at the forefront of everyone's mind at the moment during COVID-19. They're often caused by structural imbalances in society. Technology may exacerbate some of those health inequalities. If designed in the right way, it may also support reduction of those health inequalities. And whilst there are many groups who suffer from health inequalities who are within society, technology doesn't necessarily always overlap with those. So we don't necessarily have digitally excluded groups that are also the same as health inequalities groups, but they are often the same. The Venn diagram often crosses. Digital exclusion, on the other hand, is referring to the specific group in society who do not who are not able to get the most out of technology because they are not able to access it, they don't necessarily have the skills to use it, or they don't engage with it. And I've got a few key stats there, which you can go through yourself, but I mean, they speak for themselves. 5.3 million people in the UK have not used the internet in the past 3 months. This doesn't cover COVID, by the way. This covers a period in the last year, but it shows you that there are lots of people that aren't necessarily able to get the most out of some of this. Now, how that has been exacerbated during COVID, where digital exclusion is social exclusion, is something which I don't have any figures on, but it's, you know, it's not a stretch of the imagination to see the impact that lockdown may be having on those digitally excluded groups. The digital divide, which we're talking about today, is then the gap that arises from those in society who are able to benefit from technology and those who are unable or less able to benefit from technology, so falling into those digitally excluded groups. But the one point I want you to take away from this slide is that because digital exclusion occurs among those worst off in society, it's not always other societal factors that explain it satisfactorily. So, and the reason why this is important is, as I think that this debate often gets into a stage of a whole group of people talking about a load of anecdotes about, for older people, for example, who can't use technology versus a whole group of older people who anecdotally we know can use technology. And the point that I want to get across is that's not necessarily the debate that we ought to be having. We ought to be seeing people who are digitally excluded as an inequality in and of itself. And once we start to see that, we should start targeting our interventions, start targeting the way that we design our policies around that digitally excluded group itself. Cool. Next slide, please. So this is my final slide as well. So I just wanted to mention how this plays out then in the context of healthcare services. So on the left, I've been doing I'm supporting some academics on a piece of research that they've been doing with primary care professionals about their perception of this. And again, this was pre-COVID, but you can absolutely see how it would be applied within COVID as well. And what they found is that the use of digital tools seems to differ within practices, clinicians, and patients. It's subject to preconceptions about who digital tools are appropriate for, and this has implications for equity of access. So what this means is that that we don't necessarily have a good way of deciding within the context of primary care health specifically. We don't have good ways of deciding which patients ought to be getting digital tools and ought to be able to use those to support their healthcare, and who may not, and who may need more support, and who may be able to use it, but they just need they need a bit more skills and guidance. We don't currently have a good way of doing that, and that means that we're leaving it up to the preconceptions of healthcare professionals. And of course, you know, those healthcare professionals are operating within the framework that's being set for them. So we need to think about how, as a system, we can support those healthcare professionals to make good decisions about this. And the way that within our programme we're thinking about applying this within primary care is, firstly, how do we give clinicians a better understanding of the good practice that's out there? How do we support those professionals to listen to people about their needs, their requirements, and personalise access to digital healthcare? How do we then push upwards, push to the suppliers and you know, the people who are operating the technology for more inclusive design? And how can we use data and not guesswork to start to think about the different groups within our populations and how they can have different alternatives for access? So that's how we took that. Now that's a very narrow view. I think this is only a very small part of the debate, and it's within the context of access of healthcare services. But within COVID-19, I think we can all reflect that it's been a lot of the change has been very rapid within primary care specifically, and has been within access to primary care even more specifically. So hopefully that gives you a good background, a good understanding for having what I hope is going to be a really fruitful discussion. And I'm really just looking forward to listening to what you've all got to say.
Thank you so much, Harry. That does indeed give us a really great background, great framing. I'm thinking about the distinctions between digital inequalities, exclusion, and a digital divide, and also about who is excluded and why. I think that's really important stuff. So I'm going to hand over now to my colleague Sarah Brooke, who leads on a lot of our work at National Voices in the realm of digital, and she's going to facilitate the discussion now. Thank you, Sarah.
Thanks, Rebecca, and thanks, Harry. I know that there are a lot of you out there at the moment, and I know this is a huge topic and we're going to have a lot to cover. And as we've said already in this hour, our aim is to allow as many of you as possible to speak. With that in mind, if we could put up the next slide, please. I just wanted to go through a couple of housekeeping points and golden rules, if you like, that while we are talking here, to allow everybody to talk as freely as possible, that we listen and chat respectfully, that people remember to criticise ideas and not individuals. And the biggest plea of all, I think, given what we're trying to get through, is could you please all try and be as concise as possible so that we can allow as many people to speak or comment. So as we've trailed, we sent out 3 questions to you. Hopefully a lot of you have seen them in advance and had time to think. And with a view to capturing the positives as well as the negatives in all of this, we thought we'd start with a positive question. Love to hear from you with any developments that you see as positive, digital developments that are still positive and you would actually want to keep. And if Louise Bates is there, I think.
Hello.
Hi.
Hi, I'm Louise, the manager of Healthwatch Dorset. We had a focus group with some care home managers last week from Dorset, Bournemouth, Christchurch and Poole, and they talked about how positive it's been to have FaceTime with GPs, and that's been a real improvement in the way that they communicate with health colleagues during COVID-19.
That's really interesting. Thank you. Apologies. I'm not doing very well with technology at the moment.
Hi, Sarah. I think Freddie from MS Society has put a hand up. Freddie, if you want to come in now.
Thank you. I just saw that and lost it. Thank you.
Hello. Hiya. Yeah, I mean, I was on another webinar actually with some MS professionals a few weeks ago, where they were sharing what they thought was sort of the good things and the bad about having to shift to digital. And similar to that last point, lots of positives about training and being able to share expertise with other colleagues who wouldn't necessarily be able to get into a room at the same time of day. And also for people with, advanced disability, the travel to an appointment is, and I'm sure a lot of people could share this, can often be really stressful, really difficult, and often just not necessary. And so I think it's all about what the appointment is for, and I think MS professionals seem very clear on the kinds of needs, the kinds of appointments where it just isn't possible or is not appropriate clinically to do by phone or video, but there are quite a lot of other things where it is actually really helpful. And I think also what was reflected from them was very much, it isn't a kind of hospital appointment or GP appointment versus a digital option, that actually there should be more done in terms of home appointments. And again, for people with advanced disability, that's something that often isn't offered. But again, there's so much benefit of seeing someone in their home. And that's something they've said about some of the virtual appointments too, that someone's comfortable they're able to reach their notes, their medications easily while they talk. So yeah, lots of sort of cons as well, but those are some of the positives.
Great. Thank you for that. Can we move on to Sally Greenbrook?
Hi, I'm the policy manager at the British Geriatric Society. So our members are healthcare professionals who work with older people. And I think what I was going to say actually echoes a lot of the last comment. And I think we often make assumptions about older people's ability to cope with digital technology. And I think COVID has really shown that a lot of older people can cope with it and it's working really well for them, especially if they have carers around and they're able to help. And that point about having medications to hand and it being much easier to do things such as medication reviews with someone who is in their own home, who can hold up a bottle and say, this is what I've got, rather than trying to remember it when they get to the GP surgery, is something that our members have found really useful.
That's great. Thank you, Sally. Just checking if we have anyone else with any positives at the moment. I don't know if there's any questions come up, good questions come up in the chat, but please feel free to raise your hand. Hi. Lost you again.
I think it was Katie.
Katie, yes.
Hi, yes, Katie Goetz from Parkinson's UK here.
Hi there.
So a big positive we're hearing particularly from healthcare professionals and people with Parkinson's is that video conferences really allowing both parties to see and share the reality of what their day-to-day symptoms present at, and also for healthcare professionals to kind of see the environments that people are navigating in their homes and actually how that might be problematic for them, where people would perhaps benefit from occupational therapy being more involved. So that's definitely been something that's been a positive over people who generally will try and present as healthily as they can when they've made their way into a clinic. So seeing more reality of what symptoms are for people.
Yeah, that's a really good point as we go into a Zoom world where we get a little peek into everybody's homes, that actually in certain circumstances that can be vital to help develop services for them, support services for them. Okay, sorry, if I've missed anybody with a one additional, Kathleen, have I, is Kathleen Gillett?
Yeah, hello.
Hi.
Yes, I'm an engagement lead for Macmillan Cancer Support, and we're interested in peer support for people affected by cancer. And many self-help and support groups have gone online and are meeting digitally with Zoom. Some people have joined those peer support groups and been involved in peer support since it's gone online, and that's been a positive for them. And it could be a good way in to meet a group and get over that initial reticence about going into a room with people that you don't know. So it could be an interesting development that peer support groups may decide to keep an online digital meetup and alternate it with their face-to-face meetings in the future.
That's great, thank you. Possibly take one more speaker at this point. Emma Williamson, are you there, Emma?
Hello.
Hi.
Hi, my name's Emma Williamson. I'm from H for All Wellbeing Service, which is a charitable organisation, and we work with the GP surgeries. So normally we would carry out home visits to see. We started off seeing people 65 and over, but now we see people from 18 plus, and we're just really calling people. As we can't do the home visits at the moment, and currently we're not using any kind of any other kind of like Zoom meetings or Microsoft Teams apart from with our staff meetings, which are great. So it's good to have that sort of face-to-face contact with your teams, but we haven't been having that with the NHS staff. However, they're going to they're starting sort of meetings at the GP surgeries now. But I did want to really find out how possibly we could increase the use of, you know, video, sort of how we would introduce that, because it's not quite the same on the phone. It's more kind of like checking they're okay and as a befriending type thing, but to actually see how, you know, people's mobility and to see, you know, that in their own home settings and get a bit better picture of their sort of social circumstances is much more difficult without doing a home visit. And I'd just like to know kind of more how to set up that, you know, if there are people who want to do that, how we can actually start engaging in that.
Okay, thank you. So given then there are acknowledged positives, particularly around the reduction of travel for those who find it difficult to travel, and potentially a window into people's worlds where they can engage digitally. Can we move on to question 2 now and look at what gaps do we still think there are, though, and barriers that really need attention, so that those benefits, I guess, can be enjoyed by all. Apologies,
Sarah, sorry, it's Sam from
yes.
So Gilly Hager made a very good point earlier, that this conversation seems to be orientated a lot around professionals, policy people, rather than patient leaders. And it's also something National Voice are trying to break down. Gilly, I don't know if you want to come in and expand on that point a little bit more.
Yes, very much so. I actually wanted to say that we're speaking in the sense of it's missing something in the middle, and this is why I particularly mentioned, I know Emma mentioned it as well, about locality work, and I think this again, it needs to be much more locality work. I work with the PCNs. I'm part of the Nottinghamshire Clinical Commissioning Group. I'm a volunteer patient leader, but previously worked in the health sector. But I see it as being a local thing. As Emma was saying, for cancer care and cancer support for patients who were sort of diagnosed just before the epidemic and managing their situation through it, digital side has been very useful, but it needs that one-to-one to get them to link up. So I do think that that's something that needs to go back to the centre from older people to have that confidence to do it, but also to encourage them to understand that, you know, they do have a role in self-care. And I wondered if at the centre, this is something that was being widened in respect of research and feedback. I know for our recovery strategy support group, they have come to us. That means the patient participation groups and the patient and public engagement committee to get patient feedback. But it seems we're a bit late in the game.
Thank you there. Can I think there's been some great questions raised in chat as well from, is Nick Filer there on Medical Conversations?
Hello.
Hi.
Yeah, I just was thinking yesterday about this, and we were talking within the Health Innovation Manchester world about this, where I'm a patient representative, and part of the way in which, as a service user or as a citizen, I would like to interact with my primary care users and eventually the secondary care users as well, hopefully, is by feeling that I go into a secure environment like the NHS app or something similar, and then can just have a conversation. I can start by saying, I've got a problem with this, or going through some queries to say what my current symptoms might be, and then be guided through a triage system into a conversation whereby fairly quickly, maybe a receptionist, maybe an admin person, maybe a practice nurse, maybe a GP, or someone else steps in and carries on the conversation. And as long as responses are reasonably timely, short gaps like you have in normal WhatsApp conversations, you type in the question, and when somebody next goes on, you can see when you're likely to get a response, because you can see when they were last communicating, for example, you get your response coming through. So it feels like a very different type of service for users to what is currently a very kind of offline batch type environment, where you try and ring up your doctor and eventually you get through, if you're lucky, by about 4 o'clock in the afternoon, and then you begin to interact, but you get an appointment 3 weeks later. What we need is something that is real time, that actually helps most people. And at the same time, once you've solved the problem for the digital users, you also seem to solve the problem for many of the non-digital users, because the phone lines suddenly become almost unused, which means that people who opt to communicate by that means can get through very quickly. Thanks.
Fantastic, thank you. Jess, could I ask, you mentioned another name. There was another name and I've lost it, on lack of skills. Is it, given we're looking for gaps now? I think you recommended
in the chat now. Sorry.
Sorry, it's all right.
It's point from Julie from Somerset on barriers for patients and barriers for clinicians. I wanted to know if she might like to say something.
Yes.
Hi there. Sorry, just unmuted. Yeah, I think there are two levels, aren't there? There are the barriers that patients might face in that they might have the technology and the skills and they might really want to use it, but if they've got a very poor internet connection or haven't got a smartphone, if they're trying to have a video consultation, or if they're offered a video consultation, for example, that might not be possible. Can you hear me okay?
Yes.
Can you hear? Okay. And also from a clinician's point of view, you know, it's a very different way of working for the clinicians to what they're traditionally used to. So sometimes, you know, they have concerns too about if they're having a video consultation, they're worried that the patient might try and record it, that kind of thing. So there are all sorts of barriers from both sides. But I think once people have used it, they don't tend to want to go back. It's just getting them to use it in the first place.
That's great, thank you. Jonathan Moore, you've raised your hand, I think.
Hi, yeah, thank you very much for letting me speak. It's Jonathan Moore from Recent Mental Illness here. Just very quickly to flag some of the issues that we got back from some research we did with about 1,500 people, around, if memory serves me correctly, 800 of whom were in contact with secondary mental health services. I think it's important to say that it really does depend on the individual, and we did, for some people, they actually preferred being supported remotely, and again, it's important to say that many mental health services have worked like that for a long period of time, but there are also some consistent themes that came up as to why people were struggling, and it was definitely people who were more severely affected who this seemed to apply to. And the things that people talked about were how being supported remotely meant it was harder for the person who was supporting them to read their body language. It was easier for them to either be dishonest about how they were feeling or not tell the whole truth, and that the appointments they received tended to be shorter than they were when they were seen face to face, and the nature of them had changed a bit as well. So a lot of people said that when they did have a conversation with the person they're in touch with, it was more of a welfare check-in and how are you doing, rather than something that was therapeutically focused, which it had been previously. And obviously it's an inherently difficult time to deliver face-to-face services, but I do think that there is a risk that people who do struggle, particularly if they continue to not receive that for a significant period of time, then that could be quite damaging for them in the longer term.
Thank you. Thanks a lot. Maybe three more quick questions or quick comments if we can. Sam Freeman Carney, I think you've had your hand up for quite a long time. Apologies about that. Are you still there waiting to speak? Thank you.
Yeah, no problem. I just wanted to kind of highlight some of the kind of more obvious kind of gaps and barriers. I think we've kind of talked a lot about kind of those who do have access and some of the difficulties with appointments. But I mean, I think there's groups of those who can't afford broadband or the technology in order to engage. I think there's also the issue with the quality of broadband, especially in kind of rural and remote areas. It's no use being able to kind of log on and then kind of cut out halfway through an appointment. And then I think there's the whole kind of, I think both in terms of attitudes and whether people feel that they want to sort of take part through digital or engage with it. And then the sort of gap in terms of, well, there isn't really a lot of, I mean, I think maybe in the voluntary sector more, but there's not a lot of state provision in terms of enabling people, giving people the skills and understanding of how to engage with digital and to use it effectively. So I think that kind of group of people who really don't have access or don't have the knowledge and skills, there needs to be something more substantial sort of in response to that, whether that's kind of affordability and maybe subsidized broadband or kind of funding people to help enable people who haven't got the skills and understanding to be able to kind of learn that and engage. So yeah, I just wanted to kind of make that more obvious point.
Okay. Thanks very much, Sam. Nicola Kingston, I can see you making a lot of very good comments in the chat. Would you like to talk about a bit of what you're raising?
Yes, we've been talking. I'm a patient PPG chair and co-chair of the PPGs across Lambeth. We've been talking to people across the digital divide, and certainly one of the things we've been finding is that for many people, actually finding the front door of their surgery shut to casual drop-ins has really shocked them. And we've had people who've reported being in tears. And 2 of those made their way to the local pharmacy. And I'm just thinking that pharmacists could provide that bridge that we don't have elsewhere at present. Some people have been to libraries for digital access, they're shut. Some people have been to older people's centres, they're shut. We've got to be thinking about other ways to help people at present. And things like pharmacists or community leaders through faith communities. We've got to be thinking about getting health messages out there. We've also had a programme of digital champions, and I do think that's a programme that we could look into more for those communities who are not digitally able.
Yeah, that's great. Thank you, Nicola. I think that probably leads on to our final question quite nicely, actually. So following on from a couple of points that have already been raised, actually, what actions can we take then to address digital exclusion and make sure everyone can benefit?
Sarah, if you ask Kiri to speak, maybe. I think he's had his hand up quite a long time.
Thank you. I was scrolling down to Kiri. Thank you. Kiri, are you still there?
Sorry, I was on mute. Sorry, apologies. Thank you. Yeah, thanks. I think there's a couple of points. Sorry, I had to join the call late, so I missed a bit of the session. But I think some points may be highlighted. But I think from my experience, particularly working with Black, Asian and minority ethnic communities, certainly some of the messaging from COVID has come out very late, and the assumption still that we need to provide translated materials, and that's not what I've been saying. I've been telling them we need language-specific lines that would be able to then get these messages out better. From a digital point of view, I think more and more it's harder for people to use Zoom and these latest kind of technologies, but I think some of the people who don't have English as their first language are quite competent with WhatsApp now. So maybe we start looking at WhatsApp as a way of getting some of these initial messages out, because I know they won't get on. I've recently done awareness during Mental Health Awareness Week, and also last week Diabetes Awareness Week, and we did different ways of engaging. We had a mindfulness session, we did yoga, meditation, and we brought in specialists. We brought a doctor and a dietitian to get the message out on how best to manage their diabetes. But again, it wasn't very accessible because we did it by Zoom, but we then encouraged family members to help their elderly, members of those who have got diabetes to log on and then work with them. So we get supported in that way. But I think we need to look a bit creatively. But I think WhatsApp seems to be the right approach at the moment.
Thank you, Lucy. Thank you. Candida, I think you are you still there, Candida? Because I think you had your hand raised earlier, and I know you're talking about peer support groups, I think, in the chat. Would you like to talk about that? No. Okay. Catherine Gillett, you have your hand up still? Or is this for the
Hello.
Hello.
I didn't know I had my hand up still, but I have got an observation on actions to address it, which is around the point of people being unable to afford devices that they need. And I was on another webinar where people talked about a very large scale project called Devices Now, with an organisation getting devices no longer needed by big companies and passing them on in the community. But I wondered whether something much more small scale could be done, and people could take devices locally to their community centres and possibly like a bit of a repair shop thing, and have volunteers that would refurbish those devices and make them available to people who were needing them. And it could be a voucher scheme similar to the food bank. It could be linked to the digital training that goes on in libraries, for example, if people come along and say they don't have their own device. So I'd like to see some local recycling, because quite a lot of us have old laptops lying around that still work.
Yes, thank you for that. Thank you. Josie, I see you have your hand up as well. Josie Garrett, would you like to say? Add something?
Yeah, hi Sarah, thank you. Yeah.
Hi.
Yeah, I think one of the key things from our perspective, we work with Gypsy, Roma and traveller communities at Friends, Families and Travellers. One of our concerns would be that work to kind of improve digital inclusion can still risk excluding those at the particularly sharp edge of inequalities. So Gypsy, Roma and traveller communities, vulnerable migrants, homeless people and so on. And we think that there's a benefit to linking in really with kind of diverse VCSE organisations to support engagement that's representative and to ensure that solutions are kind of not only digitally inclusive, but also to identify how factors such as levels of trust might impact how comfortable people are with certain solutions that are being proposed.
That's great, thank you. Sarah Boyd, I think you've been making some good comments in the chat. Would you like to speak on local solutions?
Yes, hello. Sorry, my laptop sometimes sounds a bit echoey, so if it does, I'll stop talking. Yeah, I'm new to this, so I lead for digital inclusion at STP level and just started just when COVID hit, so I have been trying to work on it, and I've been loving all of the comments. I think we have a lot to do as organisations to make it easier for stuff to happen. So I've had lots of conversations about people really willing to support this stuff, to provide us with devices, to provide us with their time to do it, but actually getting volunteers onboarded into organisations or the kind of sign off needed for people to be accessing old bits of kit is immense. So that's kind of one of the biggest barriers that I'm seeing, and I wasn't sure if hopefully post-COVID centrally at NHS X it's getting enough focus that we'll start to see some guidance around how to do this or how to access pockets of money to do it, because that's another big barrier.
Thank you. That's great. I'm conscious of time at the moment.
Yes,
is
Sarah,
there?
I think we should probably move on now.
Absolutely, thank you.
If that's okay. Thank you so much for facilitating that discussion, and thank you to all of you for sharing your experiences and your insights. I think one of the things that really struck me actually was how many positives there are, because I think with my thinking leading up to this, I was really focused on, the gaps and who's missing, and I think, there are, of course, huge issues there in terms of safeguarding, in terms of money, in terms of language barriers and trust, and they all need to be looked at and addressed. But I was actually sort of struck by how many positives there are that I hadn't thought of. I suppose I thought in advance of this that sort of the convenience, particularly people with physical disabilities, of being able to get to appointments would be one sort of the main pro of switching to digital care. But there were so many others that were mentioned in the chat about fewer DNAs, about people being able to have their family with them, avoiding the discomfort of travel, carers being able to be with patients, and all these kinds of things. So that was really fascinating. Thank you for sharing. We're going to move on now to inviting some colleagues from NHS X who we're lucky to have on the call with us today, to sort of really respond and share some of their reflections about what they've heard and what they might be able to take back. We've got Sonia Patel, who's the Chief Information Officer from NHS X, and Emma Halliday, who's working on inclusion during COVID-19. And just, I have these two questions for them and any others who are from NHS X who are here today about what you've learned, what action you'll take back. But before that, one thing that came up from Sarah Boyd in the chat was about whether or not NHS X has a central team that's leading on this and to potentially produce guidance. Because I think there's a sense that a lot of people are having these kinds of conversations with their communities and locally over and over again. And it'd be really good to know sort of like what is happening on sort of a national centralised basis that people could be feeding into. So Sonia, are you with us? Would you like to respond?
I am with you. Can you hear and see me okay?
Yes.
I wonder if Emma would like to come in and just share a bit of the work that she's currently doing, because that's particularly relevant to the question you're asking, just to get a taste of actually the things that we've started doing. Just reminding ourselves NHS X is fairly new in its carnation, it's kind of a year in.
Hello, can you hear me? I've not got my earphones in. So good, okay. Thank you, first of all, for inviting me to this webinar. It's been really wonderful, and it's been great to hear all the people who have spoken up. I have to admit, I haven't checked the chat because I can't multitask, and it's been going really fast. There's so much information, but that's one of the tasks that I will take away, is to, once I get, if I can get all them comments, to actually take the time to go through each of them. With regards to the work that we've been doing within NHS X, so I've worked in NHS X from the beginning, and prior to that, I worked on in the patient online team with GP Online Services. So it was always about trying to get that technology out to the public, and we did work with PPG groups, but I have to admit we didn't actually take it further to localities. But one of the things that COVID has done, which has been a positive, is brought conversations cross-government and different organisations within the NHS, and we've had conversations, and I think we're going to be continuing them. We will be continuing them going forward, because we know that it doesn't just sit with one area and one department. And so if we can set up a link system, so we're not working in silos, so then we know to be able to know what's going on everywhere, and like have a map and be able to triage people to different sectors. So that is one of the things that we're working on to pull together. Now, I have been working with the Good Things Foundation's Digital Unite, and looking at having digital ambassadors and supporting it nationally, but working at that local level. So Gilly made a good point, Gilly Hagan, I think it was, about that we don't do that actual locality working. We haven't been doing that as good. So this is one thing that we want to take forward. And there was a point as well that someone made about utilising pharmacists and community leaders. So we'll definitely take that back. And a great point about not just using it as just translation and then that's the answer, because there are other ways. So what I would like to do is, another action is, anyone who would like to have a conversation with me, because I know that you've only been able to have concise points, but I'm happy to have one-to-one conversations or with your team to talk about the suggestions and what we can do to take it forward. I'll put my email in the chat.
That is really kind and generous of you, Emma, and I'm sure everyone on the call will really appreciate that opportunity to speak to you individually and directly. It's a really generous offer. Sonia.
Sorry, can I just add as well? Sorry, there was another point that someone made. I think it was Nicolas Filer about patients not being provided access to their records. So that was like what we did within GP Online Service Patient Online. So if you want to connect with me as well, and we can work on that, because it is in the GP contract that they should be providing that. So what we usually do is then give the practice a call, give them the training that they need where it hasn't been filtered down from the CCG, and just let them know that they have to, and then provide the guidance on how they can do that.
Thank you. Sonia, did you want to now follow up?
Yeah, happy to. So thank you, Emma, for sharing. So that was just to give you an insight. So also I'd like to share my thanks to you all for having me today. It's been really insightful conversation, kind of just building on some of those themes that I'm hearing today. And also, I think maybe it's helpful just to describe what a Chief Information Officer is, because that, once again, is fairly jargon, isn't it? So in terms of Chief Information Officer role, which is a kind of national role that spans across Department of Health and Social Care, and also the NHS, my key responsibilities is to kind of support the kind of digital evolution that we're looking at in terms of what we want to offer up both our citizens and also critically our workforce across clinicians and all the good people that work across social care and the NHS as well. So, you know, supporting them with the right digital tools, you know, close to my heart. And I, you know, from in my previous guises and roles, I've done quite a lot of citizen work to make sure that that we're not by design excluding communities well, and that actually we also honour choice where a choice is the right thing to do as well. So I'm really responsible for around data technology, and in this specific role that I'm doing is really to ensure that we are sharing best practice. So at the heart of today's conversation, I can see that whilst there are barriers, there are also quite some good solutions that were being shared across what's happening in local kind of areas. And clearly Emma picked up that, you know, how can we help as NHS X in actually spreading that good practice is something that we could help in partnership with other charities. So spreading best practice, making sure we're connected, and working with colleagues in NHS X to make sure we get the right level of investment, assistance and support to local areas. So that's the kind of general thing. I'm happy to have one-to-one conversations if anybody wants to know what a day in the life of a Chief Information Officer is. It's fairly interesting. But I have to say that actually for someone in my role, in some ways, the whole COVID, you know, under very challenging circumstances, has been very liberating in terms of digital technology. For some things that would have taken for years, we've seen real rapid interest and greater perseverance amongst communities that would be less likely to use digital to support their health and care. But, you know, I think it was Harry's definition, actually, I learned quite a bit from his definition this morning around actually, you know, digital exclusion is a health inequality itself, and we really need to be so mindful of that in terms of what we're looking at. So Emma and I will take that away in terms of actually making sure the tools and technology that we design out for the kind of NHS social care and our citizens, that we're really cognizant of the work that we do to make sure that we the technology to be more universal, because that's one of the opportunities tech offers us. Sorry.
Sorry, could you all please put yourselves on mute?
Anyway.
Apologies. No, nothing to apologise for. Just because we can hear some people chatting in the background. Thank you very much. Sorry, go on, Sonia.
So on the first point, investment. So investment, this is a running theme. So let's take that back. I know we've put a few offers out during COVID to support patients and citizens with sort of access to kind of broadband facilities and various other technology. I know we're doing particularly work in actually putting more technology into care homes. That's not particularly for the citizens, it's just a kind of a medium by which actually patients and care homes can connect. But I think there's so much more to do. I really like the community spirit around the devices piece, and actually, you know, in the interest of actually protecting the environment, we generate quite a lot of devicing, and how we can use that refurbished devicing to also support communities. And I think I heard one of the press stories, not about vulnerable groups, but just about families that couldn't afford enough tech to spread amongst, you know, amongst their family. They may only have one tech device, but may have 4 children at home. So how do we support those sorts of groups of communities as well, where actually they may have tech, but not enough tech to support their entire family or friends network. There was a particular point about BAME communities, and I think it's quite important that we recognise we may want to maximise on technologies that are already well used, because actually the switch cost of using new technology is fairly high as well for particular communities we want to reach out to. But we've got to make sure that they're safe and secure. So that's one of the things that we need to work on. So, you know, WhatsApp is well used and well liked, but we've got to ensure that it's kind of safe and secure for the means of actually sharing quite kind of sensitive information. And we've been able to get some safeguards during COVID, and we'll have to look at how we can extend those over kind of the overcoming future months and years. And the other things are really, I'm really interested about the pharmacy networks. They're kind of such a key part of the community and how that can help access to technology. And I really, the last point that really has hit quite a note with me is the sharp end of exclusion. I think it was Sarah, I can't remember who spoke up about that, but just ensuring
families and travellers.
Yes. And just ensuring that, you know, trust factors around, I mean, it doesn't just for those particular groups, but trust is a factor around technology. And it comes back to, whilst we do want to encourage a digital nation, also there is an element of actually where we need to include choice. And that's not just for the sharp end of exclusion. Mental health services, I've been hearing quite a lot from our mental health CIOs and consultants that actually, in the case of kind of primary and more intensive mental health care services, that actually to really get the therapeutic support, it's usually face-to-face, but it also depends on the individual. So, you know, some of the comments coming today are resonating. I think there's some really good ideas and really good work that's coming through communities that we can help and look at how we can build on in terms of a network to so this is just peer-to-peer sharing, doesn't require much investment nationally, but I also, you know, strong point, there is some national investment that might be required. So
Sonia, thank you so much.
You're welcome.
I mean, I can tell, you know, you've listened so attentively. Obviously, you know, lots has resonated with you. It's really heartening to hear, you know, all the sort of ideas percolating and what you're going to be taking back. And, you know, there've been questions on the chat about having access to a summary of the chat. So, you know, what we'll do at National Voices is we will make sure that everyone who attended today receives a link to the YouTube recording of this, to a summary of the chat, so that you can see, you know, the positives, the gaps, the actions, contact details for Emma, so that you can take her up on her offer of engaging individually. There are also there's another opportunity for you to share what your experiences are and what your insights are in relation to digital healthcare. Please, either submit yourself or encourage those that you're working with and supporting to submit their story, their thoughts, reflections to ourcovidvoices.co.uk, or write to us via info@nationalvoices.org.uk, and we can help you to write your story. So we, you know, can really develop a whole pool of insights about what's going on in this digital space and use that in turn to influence policymakers at different levels.
So can I ask?
Oh, sorry, go on.
Sorry, I was just going to say, in that kind of response and feedback, can I leave you as National Voices with one last question?
Yes,
so what does it mean to be? Yes, what does it mean to be a digital confident citizen? Because that is the definition of that would be really helpful.
Okay, we can share that question with everyone.
I don't think we've heard that patient voice in that way. We've said what needs to be done in terms of people to get access, but I'd really like to understand what the definition of a digital confident citizen would be. Yeah,
a great question, and we're happy to share it out with our networks. And we have some future webinars lined up, 3 left in this series. The unequal impact of the crisis on mental health will be on Friday, the 3rd of July, 2 weeks today. the community in a time of crisis on Friday the 17th, and sex and COVID, what are the gender dimensions of the crisis on Friday the 31st of July. Hopefully at the next webinar, I'll have some updates for you from Sonia and Emma about what they have taken forward in the fortnight in between these two webinars, which would be wonderful. And that's it really. Thank you so much for taking time out of your day today to join us, especially to the folks at NHS X and all of you charities who we know are working so hard above and beyond to support people at the moment. Thank you for taking time out to be with us here today, and we look forward to seeing you again in the future. Bye.
Thank you. Bye.
Thank you. Bye. Excellent.
Thank you.